Cardiothoracic surgeons at a rural-based referral mission hospital in the South Rift are saving the lives of children with congenital or rheumatic heart disease, one heart at a time. Children with various heart complications have undergone successful operations at Tenwek Mission Hospital in Bomet County. Sadly, majority of them are from humble backgrounds and have to endure weeks of waiting, as heart surgery is an expensive procedure. This waiting could sometimes lead to death. Tonight, we speak to the dedicated heart surgeons at Tenwek Mission Hospital that are serving humanity by restoring the health of heart disease patients and putting a smile on the faces of children with heart disease. This is Tenwek Mission Hospital in Bomet County. Long queues are a common occurrence in the waiting rooms here. Parents with children with heart disease wait expectantly, hoping to get a slot in theatre. This, for some of the patients here, is a matter of life and death.
Nilileta mtoto wangu last week on Friday. Juu ya shida ya alikuwa na shida ya moyo. So tumengoja line for like wiki moja sasa. Kesho ataingia theater.
Niligundua Davis ako na ugonjwa wa moyo wakati alipozaliwa. Alizaliwa hospitali ya Lumakanda. Ndipo walipogundua apumui vizuri. Tukatransferiwa hadi Eldoret Moi Teaching and Referral Hospital. Hapo ndipo aligundua ako na shida ya moyo.
Here, we witness the agony of parents with sick children. Most of them cannot afford the cost of treatment and surgery. That means they have to wait longer. Heart surgery is an expensive undertaking.
Daktari akatuambia ako na shida. Kuna valves yenye haitumiki. Lazima abadilishiwe. Na hiyo inataka around 1 million. So na sisi ni watu wa kujitegemea, hatuna baba wala mama.
The biggest challenge we are facing now is the massive number of patients that we are dealing with, but yet these are extremely poor patients.
In the year 2023, medics raised concern over the rise in the prevalence of heart disease in the South Rift region, which covers Samburu, Baringo, Nakuru, Kericho, Bomet and Narok counties. These sentiments were echoed by cardiothoracic surgeons at Tenwek Mission Hospital, who say the burden of cardiothoracic disease, and especially cardiac disease that requires surgery, is high not only in the South Rift, but countrywide.
Every year, there are about 10,000 patients that require to get cardiac surgery done. These are open heart operations. Out of those, about half, that is 5,000, are children below the age of 13.
Out of the 10,000 patients that require heart surgery here annually, only 500 are operated on. That is less than 5% of all the patients that are in dire need of these surgeries.
What is really heartbreaking for us medics is that every year that we don't operate on the patients that need these operations, that waiting list, many patients die waiting for the surgeries to be done.
Tenwek Hospital has become the largest single provider of cardiac surgery in the region and beyond.
We are very blessed to have developed over years significant manpower capacity comparing to our past, as well as very high level the infrastructure and the equipment that can handle any type of the majority of cardiovascular diseases.
We at Tenwek Hospital are very passionate about changing the story. We are here to change the narrative. We want to see more and more patients that actually require these life-saving operations getting the surgeries that they need.
The most common indication for surgery at Tenwek Mission Hospital is rheumatic heart disease, which is caused by a step throat infection in a young child that is not appropriately treated. This eventually leads to severe heart valve damage, which can only be treated surgically with valve replacement or repair. Medics here are working to reduce the incidence of this preventable condition, which remains the leading cause of preventable death due to heart disease.
This actually has a name called the neglected disease of the neglected. That means the burden when somebody is poor and not able to take the preventive strategy or the preventive measures, and because of not affording penicillin injection or not able to seek for early diagnosis and early management, they succumb to this devastating disease that is progressive, and then finally they arrive at our hands when they are really very, very sick.
The other large category of patients seen here is congenital heart disease. These are infants and children who were born with defects in their hearts.
Surgery yenyewe ilifanyika last week on Monday na ikakuwa successful, na mtoto ako sawa, ametibiwa, yuko salama na tunatoka siku ya Jumamosi. Na wahimiza wazazi ambao tuko na watoto wa shida kama hii yenye Davis ako nayo, mtoto wa shida ya moyo, jinsi anavyokaa huwa wanabadilika muda kwa muda. Anakuwa saa ingine purplish mdomo au mikono, au saa ingine anashindwa kupumua. Sasa usifiche mtoto, umweke ati unasema ati ni kama disability. Mtoto wa moyo anatibika na anakuwa mtoto mzima.
The hospital's Compassionate Cardiac Surgical Fund has helped many needy patients pay their hospital bills.
In a year, we do around 200 to 250 patients who have been done open heart surgery, and our key motivation is to see them wake up having recovered from cardiac disease. And that is what keeps us motivated every day.
As the heart disease burden grows, heart surgeons deep in Bomet County are making a tremendous impact upon the lives of hurting hearts.